Obesity is a complex chronic disease that is often misunderstood and undertreated, and limited insurance coverage is driving patients to unsafe GLP-1 knockoffs. Dr. Angela Fitch joins us now with more. So thank you so much for joining us. And what are the biggest risks patients face when using unapproved compounded GLP-1 drugs?
Well, Jordan, these compounded medications are not approved by the FDA, so it's really unclear how much risk a patient is putting themselves in. We don't typically take medication that is unapproved. You don't know its safety, its efficacy, or its quality because no one's checking on that because it hasn't been approved by the FDA.
Right. So definitely don't want to be taking something that has not been approved and tested and ensured that it's going to be safe for you. So why is insurance coverage such a critical factor in access to obesity treatment?
Well, it's a critical factor because many people are turning to these knockoff versions because they can't afford, the real thing. And that's the travesty here. We're trying to really advocate, as you may have heard last week, Medicare can now cover medications next year, like these medications, these GLP-1 medications for obesity. For the longest time, Medicare wasn't allowed to cover obesity, and because Medicare didn't cover it, the rest of the commercial plans didn't either. But now that we have Medicare coverage, we're hoping that transforms the delivery of care for this chronic disease of obesity to all Americans across the nation.
Right. And so what steps should regulators and policymakers take to protect patients?
Well, we think that regulators and policymakers should, stop large-scale compounding. We do not need it anymore. It is not a need in our society. There's no shortage, and that was really what it was created for, was to fill the gaps when there was a critical shortage. Now that the critical shortage is over, we believe it should stop because patients are being put at undue risk. It's our largest uncontrolled, unconsented human experiment of our time right now because patients don't understand that what they're taking is not the same as the real thing.
Right. And we want to make sure we know what we're taking. So what can patients do to ensure that they are using safe and approved treatments?
Well, the biggest thing we encourage is for them to talk to their doctor, right? Talk to your clinician. Talk to someone who's caring for you for the long haul. We are treating obesity. We are doing this as Americans for the health of it, not the weight of it, right? This should not be about a number on the scale, but this should be about gaining health, not losing weight. And that's what we really focus on. So finding a care clinician who can take care of you for the long haul, that's what you really want to do.
Where can we go for more information on everything?
Yeah, the Obesity Action Coalition is the patient advocacy arm for obesity. It's www.obesityaction.org. And you can go there and patients can go and actually find a clinician in their local area. My clinic is called Known Well. We take care of patients virtually across the country. There are other clinics like mine as well. We take insurance, both Medicare and Medicaid, and we provide comprehensive longitudinal obesity care for patients in a holistic, non-stigmatizing fashion. And that's what you want to seek out.
Yes, that sounds wonderful. So thank you so much for joining us today and discussing this important topic.
Thank you for having me.
Of course. And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.